Hello, I'm your host, Brian Callanan. I'm with council members Lisa Herbold and Andrew Lewis, the two co-sponsors of a new city ordinance dealing with drug possession and public drug use. I'm getting your questions answered, including, how will officers decide whether to make an arrest or refer someone to services? Also, what sort of treatment services are available, and how will the city pay for them? Plus, we're covering a response to gun violence, new life for the Cinerama, and more of your questions too.
When we have so much gun violence in our community, it's hard to measure all of the incidences of gun violence that didn't happen because of these investments.
The reason it's taken a little longer is we haven't enforced anything like this in 10 years.
It's all next on Council Edition. And here we are with Councilmember Lisa Herbold from District 1. Councilmember Herbold, good to see you.
Good to be back.
Also with me is Councilmember Andrew Lewis from District 7. Great to be with you as well.
Thanks for having me.
And here we go. I'm glad that both of you are here because I wanted to talk about this issue. You're the co-sponsors of an ordinance just about everybody in Seattle is talking about, a law that would allow the city attorney to prosecute illicit drug possession and some public drug use. So, quick background on this, folks. The council did not pass a version of this ordinance back in June amid concerns that there were not enough diversion measures in the bill to deal with drug addiction, a central part of the drug crisis here. Meanwhile, the state's new law making drug possession and public drug use a gross misdemeanor with an emphasis on treatment went into effect on August 15th. Now, some media outlets have said we're now in sort of a legal limbo, waiting for the city's law to be passed in September at the earliest, as the council goes into recess here at the end of August. Councilmember Alex Peterson brought up this concern at a recent Public Safety Committee meeting.
It seems Seattle is missing a mid-August deadline for the state legislation, and because nearly all city legislation has a 30-day implementation delay, we're now more than a month behind the rest of the state.
Before we get into the new ordinance you're proposing, I just want to make sure I let people know where we are right now and help out viewers who might be confused by all this. Without a city law on the books, is the public use of controlled substances like fentanyl now somehow legal in Seattle?
Thanks for asking the question that way. It is not legal. And I think your setup was really helpful in explaining what it means that the city law has not been enacted yet. It means that although public use and knowing possession is illegal, that we don't have the mechanism for the city attorney to prosecute those cases. So the police department can arrest. The King County prosecutor has the authority to prosecute. She has let us know that she does not intend to do so.
Okay.
But until the city puts the law on the books, the city attorney, our city prosecutor cannot prosecute the cases that the department might consider arresting.
Got it. So what happens to those people in between now and what I'm guessing is mid-October if we go through this usual 30-day delay that happens with implementation and the council looking at this in September? Councilmember Lewis?
Yeah, I think it's important to note that laws are worth completely nothing without enforcement. When we were considering this in June, mayor's office was officially neutral on the legislation. Police chief was officially neutral on the legislation. We did not have an enforcement plan in place from the police department and the mayor. What is in front of us now is more than a statute. What's in front of us is a plan. The mayor has promulgated his intention on how he plans to enforce this. The police chief has endorsed this measure. The Seattle Police Officers Guild Union has endorsed this measure, as has the Public Defender Association, which runs the LEAD program. So what you're seeing in front of us now is a framework for a real plan that is going to add enforcement commitments and enforcement protocols to the new law. I would point out, we just went through 2 years never adopting the interim misdemeanor that the legislature created that made simple possession a simple misdemeanor.
In 2021.
So,
right?
you know, in essence, what's really important to see a difference on our streets and to see one that is comprehensive, public safety and public health informed, is going to depend on the enforcement measures we put in place, which is in this plan.
Okay.
Those will be in place in the early fall, and we'll be able to move forward, and people will see a difference on the streets.
Can you help me, though? What does happen in this interim period? I keep hearing legal limbo, et cetera. Let's say that an officer makes an arrest on the street. What happens to that person?
Right. So what could happen, Brian, I say this as a former prosecutor, so
Yeah.
I'm intimately familiar with the process. If probable cause is established, an officer wants to arrest a person under the state RCW, they can refer that report to the King County prosecuting attorney. They can then decide if they want to pursue charges or not. I'm just going to say this as a former prosecutor. It takes weeks to review a potential case. Sometimes it can take months. There's a very high decline rate of cases, both at the city attorney's office and at the King County prosecuting attorney's office. So candidly, a difference of 30-day implementation in terms of the referral schedule is not going to make a significant difference. But I will just say one last thing. Under that RCW, if we have commitments from the executive to increase enforcement, we can start doing these warm handoffs to law enforcement assisted diversion. We can use this enforcement mechanism under the RCW while we wait for the SMC to be passed. Again, I expect in early September we are going to take action on Councilmember Herbold and my bill, so I don't think we'll have to wait too long.
Okay, fair enough. You wanted to say something.
Just to add, Councilmember Lewis mentioned the police chief and the mayor were both neutral on the earlier version of the ordinance. And to the point of the police chief's position, we were informed in the council central staff accompanying the legislation that failed that the reason that they were neutral is because these types of arrests are very low priorities. So you ask what is happening now? Well, these are already low priority arrests. So I don't think the extra couple months that we're taking to come up with an enforcement approach that actually makes this bill a much better bill for the city of Seattle, the impact that we're seeing is minimal, if any at all.
Thank you. And I want to move on to what this bill is about here. So the mayor convened a 24-member fentanyl systems work group in June to get input on the best way to deal with the opioid crisis on our streets, and that helped produce the ordinance you're working on now. The bill covers three main areas: making state law a part of the city code so that public consumption of illegal drugs is a gross misdemeanor that the city attorney can prosecute. It also designates diversion and treatment as the preferred approach in these cases and puts $27 million towards that effort. It also defines a new threat of harm standard, so differentiating between drug use that threatens others versus the individual alone. And I know it's a lot to break down here, but I want to start with this idea of diversion and treatment. I got an email that came in from Sean, one of our viewers, who wanted to ask you this, Councilmember Lewis. Can you explain more how the diversion program tied to the new drug possession law would work?
Yes. So a lot of it is some existing frameworks that we have in place that we are going to reconcile with this new framework of law. So law enforcement assisted diversion program is probably our marquee example. Wraparound case services, warm handoffs from first responders in the field to long-term case management. Really making sure that people are being met where they are, that these services are delivered in a harm reduction, public health, best practices informed way, and that there's gateways to treatment. One of the best examples of how we've really tried to do a model like this in recent history was the incredibly successful Just Care initiative downtown during COVID, where we got hundreds of people off the street. The outcomes were uniformly very positive for programs of this nature, with lots of people getting long-term housing. Overwhelming majority of people getting signed up for health insurance who didn't have it before. These are the kind, and a lot of people not returning to the streets and not reoffending. So these are the kinds of outcomes we want to lean into and really have a public health informed approach, but reserve that authority and that power for officers to seek accountability in cases where people are not seeking help or assistance and we need to have some kind of different intervention.
Thank you. And I want to follow up on treatment with you if I could and what these services can do. You actually heard from the Public Safety, in the Public Safety Committee meeting, the case management supervisor of CoLead, a diversion program which supports people without housing who end up cycling in and out of our justice system. Johnny noted that 6 years ago, he was homeless, stealing things from Target to support his drug habit.
But because somebody gave me a shot, instead of trying to send me to jail over and over again, which did not work for the 30 plus years that I was in and out of jail, I'm here today and I'm able to help other people and in turn help myself. And that's making the community better. So other people need that shot.
Councilmember Herbold, I thought this was a very powerful message, but it was also part of a presentation talking about the gaps in our city's system of services for people who use fentanyl. Talk about those gaps if you could, and then maybe if you could work in this $27 million that the mayor's talking about. Is that going to help fill some of these gaps, or what do we have here?
That's the intent of the conversation, coupled with the conversation around the new public use and possession drug law. So we have this enforcement approach that is inherent in the law that depends on both pre-file diversion and treatment services. But our providers out there who are doing this work are telling us, even if this works perfectly as it's being designed, as the architecture of the enforcement plan intends, there are still big gaps in making it possible for these warm handoffs that Councilmember Lewis talks about. And those gaps are in housing, most acutely in housing. The gaps are in employment services, in treatment services. We heard from Health One, the fire department's own program going out to serve people in crisis, talking about how difficult it is when they are going out and providing a service. The mayor recently created a special Health One unit just for overdose response. And when they're doing an overdose response of somebody who is living unsheltered, they save their lives and then they leave.
Yeah.
The person still on the street. And so one of the elements of the funding package that the mayor is proposing is this post-overdose recovery facility where somebody can, the fire department can take the individual whose life they've just saved. That person can have a few hours to recover and then talk to somebody about next steps. And when somebody has that conversation at that particular time, they're more open to having a productive outcome around what next steps are. So that's one of the programs that the mayor is proposing to fund.
I know there's a lot going on here when it comes to funding. Can we briefly talk about some of the work that went on during the supplemental budget process recently? I know you were working on adding some dollars for pre-filing diversion. You were talking about these mobile units that were going out to help. Can we do the 30-second version, if you could, Councilmember Lewis, on that?
Right. So for folks who do get arrested and referred for potential prosecution, one of the diversion measures we have on the continuum of diversions is pre-file diversion. What that means is a prosecutor in this case does a warm handoff to a service provider in lieu of charging the person with a crime. If they complete that referral, then they decline the case. They won't pursue it. Incredibly effective program. Twice as many people who go through pre-file diversion do not reoffend as people who go to jail. Very important statistic. And we increased it in the supplemental budget by 34% as far as the city attorney's office's pre-file diversion capability.
Okay.
That's going to be a big part of our focus on how we continue to make reform in our criminal legal system, get people into services, reduce recidivism on the street.
Thank you. And this is working in tandem with what the mayor's talking about and the dollars put in there too. Can you talk about these mobile units that you were trying to work, that you ended up working through with the supplemental budget as well? Again,
just looking ahead at the elements that the mayor has identified as priorities to fill these gaps. Another priority, in addition to the post-overdose facility, is this notion of having mobile treatment vans through Evergreen Treatment Services, and they work both to deliver traditional healthcare services to folks in need, but they also work to provide medically assisted treatment for folks who have substance use disorder.
Okay.
And so it's an expansion of an existing program, and it's really going to, I think, make a real difference in people's lives and also the way we experience our streetscape as people going through our daily walks of life to and from work and home.
Fair enough. I wanted to dive into one last part here with the drug bill that you're working on. This point that has drawn a lot of attention, the idea that police officers established a threat of harm from someone using drugs in public. So this empowers officers to make the call on, this is drug use that is threatening to other people versus this is a threat just to the individual. Councilmember Lewis, if I could start with you, it sounds like a bit of a gray area to me. Can you explain what this whole threat of harm concept is about and how it would work in practice?
Right. So the first thing I want to say is our police officers receive a considerable amount of training. They develop a significant amount of experience when they're out on the street interacting with these cases every day. This ordinance is very careful to call out reliance on that training and experience in establishing if there's a threat of harm. Our officers are professionals. They can be trained to the standard. This is a standard that's very important to the mayor's office to establish. If you think about situations that we as a general public are concerned about, and the reason we are talking rightly about public drug use as being not only a public health crisis, which it is, but also a public order crisis. If you're a small business owner downtown and in front of your business every day there's a significant amount of people who are smoking fentanyl, people are not patronizing your business. People don't feel safe in your neighborhood. People don't want to go outside and activate the neighborhood. It poses challenges to public order in addition to public health. That's the standard that the mayor is trying to get at, is make sure that we can have a city that is a city that works for everybody, that is a city that makes sure that there are standards and rules about what can and can't happen in public, but that that's done from a public health perspective and that that is differentiated from situations where it is purely a public health situation, where we wouldn't want to have any kind of criminal legal system involvement because it's purely about that person's public health, which should only be a medical response. So that is the standard that the mayor wants to create. Obviously, I mean, look, nothing's ever going to be perfect in the law, but I totally understand what the mayor is going towards. I think it's a good balance. A lot of work went into putting this in place, and I support the mayor's decision.
I can picture what you're saying when it comes to blocking off a business and how that could be a threat of harm potentially to the neighborhood, et cetera. Can you give me that example where it is a threat to the individual only? What does that look like?
Right. Look, if there's a situation where a person is struggling with addiction, but they're not in a broader public point of view, they're in a position where maybe they're not in as activated of a space. Maybe they are in their own residence.
Yeah.
Right? I mean, in that case, it wouldn't be necessarily completely public.
Okay.
But I think that you can see these situations where it really just goes into the triage of what do we get up with every day right now and think, our recovery is being held back because certain public areas, parks, areas in front of businesses, the general use of the public is being inhibited because areas are becoming predominantly used for the consumption and use of drugs in public. And at a certain point, that has a corrosive effect on the ability for us to have a functioning city.
Right. Some thoughts on this whole threat of harm standard, please.
I think one of the reasons why it's a little bit difficult to conceptualize is the ordinance itself is sort of broad paintbrush strokes of what is intended. We're going to have more sort of nitty-gritty direction in the police department policies that will be developed as part of this ordinance. This ordinance contemplates that there will be policies consistent with the ordinance that will be promulgated, and we expect to have them as well by the end of September.
Okay.
So it'll go a little bit more into sort of some of the objective facts that officers will be asked to measure in determining this threat of harm standard.
And threat of harm, this is something that officers engage with today. And I don't think that there's anything necessarily new about it, but applying it in this way feels like, is there going to be new training around this for officers, or how is that going to work?
I think we are anticipating that there will be training associated with the policies. You are right. Officers use their discretion every day, many, many times each day in making determinations of how to address activities that may not be legal. There are often choices that are made to not arrest or not ticket. And so this is going to be very much in line with that discretion-making approach that officers always use. But I think there will be some more meat on the bones of the policy that officers will need to be trained on.
Thank you. Maybe I could just wrap up by asking, what impact do you think this new ordinance, when it is passed in September, as we anticipate here, what impact is it going to have in the city a few months from now, next year, et cetera? Some thoughts on that, and then I'll go to you, Councilmember Lewis.
I think it's going to provide clarity to a 10-year struggle that we've had as a local government community on exactly how we deal with this situation. We had to call the question on it. The previous discussion that we were having around this policy area didn't have any commitment on what we were going to do to actually give life and enforcement to the provisions within the statute. We have tons of examples of passing a statute, putting it up on the shelf, and no one ever does anything with it. By bringing this measure that Mayor Harrell has promulgated to us, we, like I've said earlier, have a plan, not a statute. The statute's part of a comprehensive plan. This is what we really need to do. It's something that's been missing in our local government for 10 years. It's public health informed, and it's something that I think is going to make a visible impact. That is my hope, and that is what the people of the city expect. These tough questions come down to us. The state can set big policy, but it's local government where it has to be enforced.
Got it.
And that is why, candidly, I'll just say to the public, the reason it's taken a little longer is we haven't enforced anything like this in 10 years. And it's easy for the state to promulgate a mandate, but it comes to us to realize how do we organize our limited resources to make the biggest possible impact on implementing their intent. And that, unfortunately, takes a little bit of time.
Thanks. Wrap up this thought, please.
State went into special session to do their version of the ordinance. Now, we needed some extra time to figure out how to locally enforce the ordinance, and frankly, how to ensure that fewer cases are going to be prosecuted. We really want to make sure that we are adhering to the state guidance that emphasizes diversion and treatment before prosecution.
Thank you. I'm going to move on here, if I could, and pick up the pace slightly with you, Councilmember Herbold. Changing gears to the issue of gun violence. Seattle's had an uptick in gun violence this summer, as we all know, including some deadly incidents in District 1, which you represent. We got a message about this issue from one of our viewers. Bill asked this: I'd like to know how we in Seattle can ever expect to successfully combat gun violence, given the free flow of guns everywhere in the U.S. This is such a difficult question, I know, for all lawmakers, but how do you respond to that?
I'm appreciative that the person contacting you really focused on the fact that it's the access to guns and the huge number of guns that Americans have that are really at the forefront of the reason for why we see all this gun violence. During COVID and after COVID, we've seen exponential increase in gun ownership. I'm grateful that our state legislature has taken really important strides in sensible gun ownership responsibility laws, but we have to do more. There's so much more to do, and I'm really proud of a lot of the community-based organizations that are doing gun violence interruption work in our communities. They are actually going out to scenes of violence. They are working with victims and family members to make sure that the repetitive cycle of violence that is often in retribution for prior acts of violence are ended. And a lot of our investments in programs like our hospital-based violence intervention program are really making a difference. It's hard to measure when we have so much gun violence in our community. It's hard to measure all of the incidences of gun violence that didn't happen because of these investments. But these are folks who are out there every day on the streets, putting themselves in harm's way. We saw what happened down in Rainier Valley a couple weeks ago. That was at a violence prevention
safe passage.
effort.
Yeah.
Yes.
Yeah. Thank you for that. I wanted to make sure I moved on to Councilmember Lewis with another important issue. You were recently named to a subcommittee that's focusing on how to make the King County Regional Homelessness Authority more accountable and more effective. KCRHA has been under a lot of scrutiny, as we know. CEO Mark Doan stepped down a few months ago. The agency has had some challenges paying its contractors, among other issues. What are your concerns about where the KCRHA is right now? What do you expect out of the authority heading into the future?
Well, I certainly have a lot of very strong personal opinions, having served on the inaugural governing board and also being in the unique position of someone who unfortunately, was not in office to have any say over the original interlocal agreement. So I'm sort of in this position of having served in a dysfunctional system that I had no hand in being able to create. So I definitely have some feedback going into this process.
Yeah.
There needs to be streamlined accountability. We have a weird bifurcated board system. There's a governing board and implementation board. I don't think that's good for accountability. It creates double the work. Two boards creates double the work, in my opinion.
Yeah.
I think that there should be some streamlining, consolidation of that oversight. We need to be very clear with what we expect from the next CEO in terms of what their job is, what their responsibilities are. Obviously, first and foremost has to be the predictability, reliability of getting contracts out on time. Making sure that the people who are doing this work can get paid and can meet payroll is essential to making progress on homelessness in this county. We have to get it right. We need a regional solution to this. We can't continue to do this as 39 separate jurisdictions in King County. That's the number of cities in King County.
That's right.
We need to come together and do it jointly as a King County regional government and as these 39 partner cities. We can do that work. We can get it done. I'm looking forward to working on this task force to harmonize the way we can do this efficiently, effectively, and deliver for the people of this county.
Thank you very much for that. Councilmember Herbold, I want to talk about the recent work that you spearheaded to pass a new set of protections for app-based workers, so protecting delivery drivers, et cetera, from getting deactivated off the app. Seattle's the first city in the country to pass legislation like this. What does this mean for workers and for people who use these delivery services?
Well, hopefully it means a little bit of transparency in their security for their income earning. These are not considered employees in this country under our employment laws. So a lot of the things that we take for granted as employees are not the kinds of protections that they get as app-based workers. This bill follows on another bill that Councilmember Lewis and I worked on that guarantees a minimum payment standard for these workers because, again, we have a great minimum wage here in Seattle and Washington State. These workers aren't entitled to that minimum wage protection. So we have a separate standard for app-based workers. And similarly, the legislation that was just passed provides, again, it doesn't eliminate the ability of a platform to deactivate somebody, but it requires that platform to notify the person of the reason and give them an opportunity to appeal. A lot of these decisions are made by algorithms. They're not even made by real people.
Yep.
And people will open up their phone, getting ready to work, and they can't access the platform, and they have no idea why, and there's nobody to talk to. And hopefully this will address that.
In 7th grade math, I always thought algorithm was a good thing, but I'm learning differently. Councilmember Lewis, we need to wrap up. I can take about a minute here. I want to bring the curtain up on what's going on at the Cinerama. You recently visited with Tom Mara, Executive Director of SIFT, the Seattle International Film Festival, which has recently announced it will buy and operate this iconic theater. It's been closed down since 2020, set to open later on this year. What does this mean for the city of Seattle?
Well, thanks for asking, Brian, because I'm really, really proud of this work. This is a year and a half in the making. My office working with Seattle International Film Festival and other partners to find a viable strategy to get this into nonprofit ownership. As you know, used to be owned by the late Paul Allen. His estate did not have any immediate plans for a successor entity. Really glad we were able to close a deal with Seattle International Film Festival to take this over, put it in nonprofit ownership for the first time. This can really be a hub where our marquee theater in the Pacific Northwest, marquee movie-going experience, now is going to be a big source of public benefit to the broader community. Things like local film festivals highlighting local artists, the educational and workforce development components that can come with developing our local film economy. This is all possible given this new ownership arrangement, given that this is now going to be SIF operated. And in the supplemental budget, worked with SIF to get $1 million of support to support some of these initiatives around workforce development, public benefit, and really looking forward to how that becomes a big part of our downtown community going into the future.
And any truth to the rumor, the first film to be shown there will be Seattle City Council, the 70-millimeter experience.
Yeah, I can't confirm or deny it.
I like it. Okay, we'll see what happens when the curtain goes up. Thank you both for joining me, and thanks everybody for watching Council Edition. We'll see you next time.